Is tinnitus the first sign of dementia? Welcome to our new video, which is based on the most current scientific research in neuroscience. So now we are going to talk about tinnitus itself, being a symptom of a much worse problem than just a noise in the ears or some other typical tinnitus symptoms. For some time now, researchers have been concerned with the changes in the brain's cognitive abilities and functions known to affect many tinnitus sufferers. So one of the main questions was a typical chicken or egg type of puzzle. The question was simple. What is causing what? Is tinnitus causing a cognitive decline or the other way around? At Metro Hearing and Tinnitus Treatment Clinic, we have proudly used advances in neuroscience for many years in many treatments, including complete tinnitus treatments and even low-cost or distant patients' tinnitus therapies. One of the main reasons for studying this field of science comes from understanding that progress and much greater knowledge of the human brain and even body functions come from learning more and more about the importance of the human brain and the processes taking place in what we call the human mind. Obviously, advances in computer science and a growing number of universities and scientists involved in this research have resulted in a much better understanding of some of the brain functions science was only partially aware of for many years. Yet, there are many unknown factors and processes which are, for example, involved in some serious or even terminal medical conditions, such as Alzheimer's disease. Still, there are confirmed on countless occasions research findings known to be a foundation for many new, very promising therapies, which are used more and more often to treat many conditions, such as chronic pain and others. So, what does neuroscience have to do with tinnitus? Well, actually quite a bit. This is not even because of Professor Pavel Yastrebov's fundamental work on tinnitus retraining therapy by implementing the neurophysiological model of tinnitus and other conditions such as hyperacusis or misophonia. Current research is showing us and confirming the value of many very promising and used approaches and therapies. Still, it offers new and important facts playing a significant role in our understanding of the tinnitus process as a part of what seems to be a crucial aspect of brain functioning. So please sit down, relax, and watch our video. This one really can change your life and give you what is known to be priceless: knowledge and understanding of what tinnitus really is and why it is so important to treat tinnitus as present seriously by searching for the best solution to remove it from the sufferer's life. Please subscribe to our channel and remember to give us a like to encourage us to do even more work to present you with the best proven tinnitus therapies or treatments and the single most important gift of knowledge. Talking about this part of our work, we are very pleased to inform you that we've got some fantastic news to share for all tinnitus sufferers in Southern Ontario. Our clinic is currently providing low-cost consultations for a limited time, specifically for those of you who are suffering from severe or catastrophic tinnitus. To make an appointment, use a link to our website or call our clinic directly. Also, we have decided to offer a special one-in-the-clinic visit-only program to all patients whom we refer to as distant patients, coming from various locations in Canada and the US, especially when local professional tinnitus treatment clinics are not accessible to them. This program is just a continuation of what we used to do for many years and is built on the successful implementation of the most effective therapies used in our clinic. But going back to the topic of this video. There are many tinnitus causes and onset triggers. Still, the common understanding of this condition's nature almost always includes what we call preconditions. Some major ones are based on what is happening within the auditory system, even if this sort of distortion is not connected or is not based on hearing loss presence. This is one of the reasons tinnitus is more common in the older population, when nervous system and brain degenerative processes become increasingly visible, often leading to the onset of various medical conditions. Hearing loss, especially what is the most common and known as sensorineural hearing loss, is one of the most common signs of the degenerative process affecting the auditory system. In one of our videos, we were talking about tinnitus and hearing loss connection, and we strongly recommend watching this video to better understand what we will talk about now. The prevalence of just hearing problems reflecting changes within the auditory system in the Western world has, due to the aging of the population, doubled over the past 30 years. This also confirms the role of noise-induced hearing loss as an important factor known to worsen over time in addition to age-related hearing loss. When talking about the hearing loss and tinnitus connection, we must remember that recent animal studies have unraveled a type of permanent cochlear damage which would indicate hearing loss without an elevation of hearing thresholds, confirming the presence of hearing loss. This subtle damage is linked to a permanent and progressive degeneration of auditory fibers associated with inner hair cell synapse damage. This type of neuronal degeneration has been suggested to be involved in hyperacusis, decreased tolerance to loud sounds, and tinnitus. Hyperacusis and tinnitus are potentially devastating conditions that are still incurable. The main risk factors for developing tinnitus or hyperacusis include hearing loss, elevated levels of anxiety, and long-term stress, old age, and many others. These factors include various preconditions such as certain medical conditions and their side effects, as well as genetic predispositions encoded in our DNA. For some time now, some research findings have been published worldwide, indicating chronic subjective tinnitus has many similarities with chronic pain. So as we can see, tinnitus is now considered a very important condition. It is not only treated as a separate set of symptoms connected only to the auditory system's internal problems, but also shares similarities with symptoms or manifestations of other conditions. This common understanding of tinnitus symptoms as a warning signal from the brain is gaining new meaning. As we've emphasized in our clinic, tinnitus should be taken seriously, not only due to its annoyance and its impact on our lives, but also as a potential indicator of more serious underlying health issues. This is why a proper medical investigation is always recommended, and some specialists, such as ear, nose, and throat specialists, should be involved in this investigation. Now, there is one more valid question. What about the involvement of psychologists or other specialists? We know very well that although sometimes called an old age disorder, tinnitus has emerged as a serious public health issue worldwide in the last 20 to 30 years, affecting approximately 50 million Americans in various age groups. It is also well known that approximately 10 to more than 20% of individuals who experience tinnitus report severe symptoms that drastically reduce their quality of life. Among American veterans, for example, tinnitus is the number one service-related disability and impacts more than 2.17 million veterans overall. There are more and more research reports published almost every day indicating some other tinnitus-related findings which indicate not only changes in the neuronal networks caused by the tinnitus presence, but also some other factors having an effect on the tinnitus onset, which were not treated seriously or not even recognized at all not that long time ago. For example, stress is often attributed to a cause of tinnitus, and we often see in the clinic that patients complain that their tinnitus worsens after stressful situations. The evidence that stress is related to tinnitus is based on studies showing high numbers of psychiatric conditions in tinnitus patients. About 10 to 60% of chronic tinnitus patients suffer from depressive disorders, and 28 to 45% from clinically relevant anxiety symptoms. According to the authors of Tinnitus, the Sound of Stress, it has been frequently observed that many tinnitus patients report psychological or psychiatric distress before or during the onset and evolution of tinnitus. Some studies using stress questionnaires on tinnitus patients found a very high prevalence of self-reported stress levels. In the research paper published by GAMA, we learned that among 100 patients with tinnitus, only 25 didn't have stress. 44 had mild to moderate stress, and 31 had severe to extreme stress levels. There seems to be a cause and effect relationship between tinnitus and stress. Stress is often attributed as a cause of tinnitus, and we almost always see in the clinic that patients complain that their tinnitus gets much worse after stressful situations. More evidence that stress is related to tinnitus is based on studies that show high psychiatric comorbidity related to the symptom. About 10 to 60% of chronic tinnitus patients suffer from depressive disorders, and 28 to 45% with clinically relevant anxiety symptoms. But what really seems to be a game changer in our understanding of tinnitus is connected to what was perceived as just one of many tinnitus symptoms affecting severe or catastrophic levels tinnitus sufferers, as measured by using the THI scale. And this is what our video really is all about. So now we are going to talk about tinnitus itself, being a symptom of a much worse problem than just a noise in the ears or some other typical tinnitus symptoms. For some time now, researchers have been concerned with the changes in the brain's cognitive abilities and functions known to affect many tinnitus sufferers. So one of the main questions was a typical chicken or egg type of puzzle. The question was simple. What is causing what? Is tinnitus causing a cognitive decline or the other way around? In the June 28, 2021 issue of Scientific Reports, a team of renowned scientists led by Yang-Fu Cheng published a study titled Risk of Early-Onset Dementia Among Individuals with Tinnitus, a retrospective case control study. This paper has gained global recognition as one of the white papers signaling a new research direction that recognizes tinnitus as an early warning sign or symptom of potentially devastating medical conditions linked to degenerative processes in the human brain. Early-onset dementia is defined as dementia diagnosed before the age of 65. The symptoms of early-onset dementia are similar to those observed among older people: behavioral changes, cognitive decline, and psychiatric manifestations. The diagnosis of early-onset dementia is particularly challenging because the current diagnostic criteria require evidence of cognitive impairment and memory loss. Younger patients whose dementia is limited to progressive cognitive decline or focal neurological impairments may not be diagnosed with dementia or eventually receive a delayed diagnosis. Also, studies show that patients with early-onset dementia take longer to seek their first consultation for dementia evaluation. Dementia is frequently described as a disorder characterized by a significant decline in cognitive abilities. The development of dementia involves complex processes involving specific molecular pathways affecting multiple cellular functions of the central nervous system, leading to disruption of the functional networks underlying cognition, behavior, and sensory motor functions, and eventually eroding the autonomous functioning and decision-making abilities of affected individuals. Team of well-known scientists in risk of early-onset dementia among persons with tinnitus, a retrospective case control study we have mentioned before, has revealed that higher rates of poor cognitive performance prevail among persons with tinnitus in all age groups. However, as they noticed, no study has explored the association between tinnitus and early-onset dementia. Still, the research findings hypothesize that tinnitus may proceed or occur concurrently with subclinical or early-onset dementia in adults younger than 65. Yang-Fu Cheng and his team of scientists reported that after adjusting for sociodemographic characteristics and medical comorbidities, patients with early-onset dementia had a 67% higher likelihood of having prior tinnitus. Their findings show that pre-existing tinnitus was associated with a 68% increased risk of developing early-onset dementia among young and middle-aged adults. Cognitive impairment has been reported as a common occurrence among tinnitus patients. Mild cognitive impairments, MCI, an intermediate state before dementia patients transition into clinically evident dementia, have been reported among patients with tinnitus. Many other studies have shown that tinnitus is associated with cognitive deficits and that tinnitus patients on the severe end of the spectrum are at high risk of serious cognitive deficits. So, in the end, Yang-Fu Cheng and his team of scientists concluded that their finding suggests a potential link between tinnitus and early-onset dementia, which may serve as an early warning sign to elevate awareness of dementia risk among tinnitus patients to proactively watch for early signs of dementia among young and middle-aged patients. Many of you watching this video might be thinking that one study, or even a few more, shouldn't be taken into seriously because mainstream science isn't quite ready to accept their findings. However, it's important to know that this is just one study among many. There is a widely recognized and highly regarded white paper that was published in July 2020 called Tinnitus and the Risk of Alzheimer's and Parkinson's Disease, a retrospective nationwide population-based cohort study, which appeared in the journal Nature Scientific Reports. This paper provides us with valuable insights into the connections between tinnitus and Alzheimer's disease and even Parkinson's disease. In this study, we can read, and I quote, that rates of tinnitus increase with age, and studies have found that hearing loss as well as central auditory dysfunction more generally are associated with higher risks of cognitive dysfunction, particularly dementia, control of attention, and working memory. After adjusting for confounding factors like diabetes, head injuries, and income, the researchers determined that patients with tinnitus were 1.54 times more likely to develop Alzheimer's and 1.56 times more likely to develop Parkinson's. End of quote. Suppose these findings can be replicated and validated in future studies, and many researchers are working on various projects as we speak. In that case, they open new avenues for research into the pathology of both Parkinson's and Alzheimer's. A possible cause and effect relationship between tinnitus and either Parkinson's or Alzheimer's raises the question of whether preventing and treating tinnitus could prove effective at reducing the incidence. By this reasoning, they suggest that the clinical features of tinnitus may be driven by the underlying processes contributing to the progression of Alzheimer's and/or Parkinson's. Moreover, a recent retrospective study found that people with tinnitus had a 63% higher chance of developing early-onset dementia, even after considering confounding factors like hearing loss. In conclusion, and to summarize what we have learned watching this video, we can say that some possible mechanisms exist for exploring the association between tinnitus and Alzheimer's disease and Parkinson's disease. According to what we now know, inflammation may play a role in causing neurodegeneration. It could be connected to and even come before a condition where blood flow and therefore oxygen is limited or decreased in a specific part of the brain. Tinnitus research finds that inflammation may trigger ringing in the ears. The clinical features or otherwise symptoms of tinnitus may be an extension or side effect of the primary pathological process of Alzheimer's disease or Parkinson's disease. So just like we often emphasize to our patients in the clinic, it's crucial to take tinnitus seriously and do everything you can to minimize its impact or ideally eliminate it from your life. As we've discussed before, the potential link between tinnitus and conditions like Parkinson's or Alzheimer's raises an interesting question. Can preventing or treating tinnitus also help reduce the risk of these diseases? Right now, science doesn't have a definite answer to that question. However, there are some key points we do know, and they are as follows. Tinnitus should be treated seriously and investigated thoroughly by qualified medical doctors, starting with the family physician. Tinnitus should be addressed as quickly as possible by using proper therapies or treatments in order to truly habituate symptoms and limit the tinnitus present to nothing, no sound, no other symptoms. Tinnitus should be treated as a serious call for lifestyle change, including all aspects, with special attention paid to the importance of sleep, stress, and anxiety reduction or elimination, diet changes, and a regular physical activity routine. This should be included in the proper and effective tinnitus treatment, such as the treatments we provide our patients within Metro Hearing and Tinnitus Treatment Clinic. We're all working together here at Metro to make this video a game changer for you. Our goal is to provide you with valuable knowledge about tinnitus and why it is crucial to treat it seriously by seeking effective solutions. We've put in many hours to create this video. Please take a moment to share your thoughts in the comments and let us know if they have been helpful to you. As you know, our clinic currently provides low-cost consultations for a limited time, specifically for those suffering from severe or catastrophic tinnitus. To make an appointment, use a link to our website or call our clinic directly. This would be your best chance to learn all about tinnitus. And do not forget about our special offer of one in the clinic visit only program. It is especially designed for all distant patients traveling from different locations in Canada and the US. This program is like the next step of what we've been doing for a long time. It's based on the treatments that we've worked really well in our clinic before. Thank you for watching.